Yeah. Good morning. My name is Tashiro Chikamori from Tokyo. It is my privilege to be invited to the joint symposium on nuclear cardiology and neurology, which is organized by the Taiwan Society of Nuclear Medicine. I will give special thanks to the organizing committee. Now, let's get started. Ladies and gentlemen, and their colleagues, my task in this virtual symposium to share with you the idea how to apply microspect with the use of an ultra-fast cadmiogenic telluride CZT gamma camera system in order to extend the field of nuclear myocardial imaging. This is my COI slide. This slide shows the system design of CZT NM530C, one of the CZT gamma camera. In this system, 19 stationary CZT detectors simultaneously acquire 19 views of the entire heart without motion. The merits of this system are: one, more than five-fold shortening of scan time; two, reduction of motion artifact due to a collimator rotation; three, reduction of body motion artifact. By applying this ultra-fast CZT gamma camera, I will share with you what we have recently developed in nuclear myocardial imaging. My talk consists of three parts. First, development of an ultra-fast gamma camera system with adequate acquisition protocol. Second, hybrid imaging with CZT SPECT and CT coronary angiography. Third, dualized of imaging using iodine 1,2,3 beta iodophenylmethylpentadecanoic acid, BMPP, and technetium radiotracers. Firstly, I will explain the way in which we have developed this ultra-fast CZT gamma camera system, in particular to settle an adequate acquisition protocol for Japanese patients. At first, we prospectively compared myocardial perfusion imaging in the same patient between this CZT camera and a conventional ANGA camera system. The study protocol is shown in this slide. After exercise stress or pharmacological loading, 370 megabecquerel of technetium radiotracer was administered. After 60 minutes, image acquisition was commenced with the ANGA camera, then a CZT camera. The scan time was 15 minutes for the ANGA camera and 5 minutes for the CZT camera. 4 hours later, 740 megabecquerel of technetium radiotracer was given at rest. And then image acquisition was started, as shown in this slide. In this study, 150 patients with known or suspected coronary artery disease were evaluated. An average age was 70 years old, and the body size was typical for Japanese patients in this age group. Data acquisition and image reconstruction are shown in this panel. As conventional ANGA camera system, Prism 3000 XP or IRIX was used. The study protocol was one-day stress rest protocols as explained previously. The total dose of technetium radioisotope was 1,110 megabecquerel, which was almost maximum dose by the Japanese regulation. To analyze a myocardial SPECT image, we applied the conventional 70-segment model with 5-point scoring system. Then some stress score, some rest scores, and some different scores were calculated. In the result, correlations of summed stress score, summed rest score, and summed difference score between CZT and anger camera were excellent, with the R value of 0.83 to 0.95. The Brand-Altman plots showed acceptable limits of standard deviation. In regard to LV volumetric and functional analysis, data derived from CZT and anger camera indicated good correlations and acceptable result of the Brand-Altman plots. In regards to LV volumetric and functional analysis, to evaluate the concordance of myocardial perfusion scores in individual segments between the CZT and anger camera, we applied a kappa analysis for a total of 2,550 segments. Kappa value of 0.85 was observed. However, this value decreased for the RCA territory. We summarize our initial study as follows. With the scan time of 5 minutes after stress and 3 minutes after at rest, the image quality of MPI was rated as excellent using the CZT gamma camera in 150 patients. The majority of the patients preferred the CZT camera for the next assignment of MPI. The correlation coefficients for summed scores and LV functional parameters between the two measurements were strongly positive. The Brand-Altman method showed an almost null bias and acceptable limit of standard deviation. Regarding the per segment analysis, including a total of 2,550 segments, a strong concordance with kappa of 0.815 was observed in overall segments. However, when these segments were categorized based on the three coronary territories, the concordance rate decreased, particularly in the right coronary territory with kappa of 0.774. In the next step, investigators in 4 institutions in which the CZT SPECT system has initially been introduced in Japan have formed the Semiconductor SPECT Study SSS group by the support of the Japanese Society of Nuclear Medicine. The SSS group registered 1,000 patients to evaluate the diagnostic utility of the CZT camera system of discovery NM530C. The name of the investigators and institutions are shown in this slide with Japanese character. You may be able to recognize some Japanese regions such as Ehime and Tokyo with this character. The primary result of the SSS study demonstrated that in the detection of individual coronary artery stenosis in 1,000 patients, the respective sensitivities, specificities, and accuracies were 74%, 85%, and 81% for LAD stenosis, 76%, 89%, and 85% for LCX stenosis, and 72%, 86%, and 82% for RCA stenosis. The diagnostic performance was re-evaluated according to different radial tracers used to detect LAD stenosis, 99% sensitivity, and 66% sensitivity, and 91% specificity were observed with technetium radiotracers. Whereas 88% sensitivity and 63% specificity were found with thallium. A similar trend was observed in the detection of RCA stenosis, although no significant difference was found for LCX stenosis either with technetium radiotracer or thallium. By reviewing these results and numerous SPECT images, the SS group hypothesized that extracardiac accumulation of radioisotope, such as in the liver or intestine, may cause significant reduction of inferior wall uptake, particularly in the CZT camera system. Then this hypothesis was examined by phantom experiment. In this experimental model, the distance between liver and myocardium was the same in the Discovery NM530C and Anger camera of Prism IRIX. However, large areas of perfusion defect were observed only in the CZT camera. Considering these results, every effort should be made to reduce extracardiac accumulation when using the semiconductor gamma camera system in clinical practice. The next peculiar findings of Discovery semiconductor camera was high accumulation of radiotracer in the anterior wall, which is clearly shown in this slide. Therefore, the SS group collected the raw data for SPECT image and compared them with those of the Anger camera, which were established by the JSNM working group. Among several differences of RI distribution between the Anger and the CZT camera, higher accumulation in the CZT camera was observed, particularly in the segments 7 and 13, which were the center of the anterior wall. Based on these results, based on the result of these studies, our institution sought to reduce radiation exposure from micro SPECT. We applied a simple approach to reduce the dose of radioisotope by half and to extend the acquisition time by double. The image quality of SPECT is shown in the upper column, and micro-RI counts are in the lower column. While the conventional dose was administered in the left-hand side, the half-dose protocol was applied in the right-hand side. You can notice that both bar graphs are almost identical. This is the study protocol for stress MPI, which has been applied in Tokyo Medical University until now. A total dose of technetium phosphine was 555 megabecquerel, and the scan time is up to 10 minutes. With this protocol, estimated radiation exposure is only 4.5 millisievert. This SPECT image is that of the first patient to undergo this low-dose protocol after approval of the ethical committee of our institution and informed consent from the patient. Clear SPECT image with inferoposterior perfusion defect were observed. Negative SPECT image of this patient also detected inferior akinetic motion. To establish this low-dose acquisition protocol, we prospectively evaluated 102 consecutive patients with suspected or known coronary artery disease. In this study, the gold standard for a significant coronary stenosis was defined by fractional flow reserve. To detect individual coronary artery stenosis, the respective sensitivity and specificity and accuracy were 86%, 75%, and 82% for LAD stenosis, 76%, 81%, and 79% for the LCX stenosis, and 87%, 92%, and 90% for RCS stenosis. And now that we are confident with this low-dose protocol. Next, I will present hybrid imaging with CT SPECT and CT coronary angiography. This slide shows hybrid imaging of an 86-year-old patient, which was presented in European Heart Journal. In the lower column, the relation between coronary anatomy and myocardial SPECT is clearly observed. Although this picture is very attractive, the Achilles tendon of hybrid imaging was significant radiation exposure from both CT angiography and high-dose radioisotope. However, the development of CT technology has made a breakthrough in this field. This 256 detector row CT system enables very low radiation exposure to obtain CT coronary angiogram. A typical example is shown here. Coronary tree and MPR image are clearly demonstrated with radiation exposure of only 0.4 millisievert. Therefore, this clear hybrid image can be obtained with radiation exposure less than 6 millisievert. Let me stress here that hybrid image gives us indispensable findings which are consisted of both functional and anatomical information. Then we evaluated the diagnostic impact of this hybrid SPECT and coronary CT in patients with suspected coronary artery disease, and presented the study result in AHA scientific session last year. In this slide, the SPECT image of CZT gamma camera, CT coronary angiogram using 256 detector row CT and invasive coronary angiography in the same patient are presented. Then, image fusion of SPECT and CTCA datasets was performed on a dedicated workstation. In this hybrid image, the extent of myocardial perfusion defect was reliably estimated in relation to coronary anatomy. In the main result, higher diagnosis performance of 93% sensitivity, 87% specificity, and 90% of accuracy was observed in detecting significant coronary stenosis using hybrid imaging as compared with SPECT or CT angiography alone. One of the notable weaknesses of CT coronary angiography is calcification of coronary artery. In this study, 22 coronaries with severe calcification proved difficult for CTCA alone, but hybrid imaging enables accurate diagnosis. A typical case is presented in this slide. In this case, the ostium of the first diagonal branch was difficult to evaluate because of dense calcification there. However, hybrid imaging demonstrated hyperperfusion hyperfusion with fill-in the diagonal territory. Invasive coronary angiography revealed a severe stenosis in the ostium of the first diagonal branch. We concluded that the increase in accuracy in the hybrid SPECT CTCA approach in comparison to a single method, either with SPECT or CTCA alone, is significant enough to impact our clinical decision making. Lastly, I will present dual isotope imaging using iodine BMPP and technetium radiotracers. Before going to this new dual isotope imaging, I had better explain the basis for ischemic memory of BMPP briefly, since BMPP microarray imaging is rarely applied in clinical practice outside of Japan. This is the structural formula of BMPP, which is the fatty acid analog. This radiotracer facilitates metabolic imaging of diseased myocardium because 60 to 70% of the energy requirement of the normal myocardium under aerobic status derives from the metabolism of free fatty acid. The retention mechanism of BMPP in normal and ischemic myocardium is shown in this slide. Under ischemic condition, beta oxidation fatty acid in mitochondria is reduced, and back diffusion and early washout of non-metabolized BMPP occur. This abnormal metabolic pathway is considered to be responsible for the reduced myocardial uptake of BMPP detected by SPECT. Dr. Higuchi et al. Conducted a thoughtful experimental study using a rat model showing in this slide. After occlusion and reperfusion of a coronary artery, the time course of discordant BMPP and thallium uptake was clearly demonstrated. The BMPP uptake increased in the acute phase after reperfusion, followed by a decrease in the subacute phase and recovery in the chronic phase. This suggests that BMPP metabolic imaging detects the area at risk and serves as a means of ischemic memory imaging. This slide shows the typical BMPP marker images in a 77-year-old man with unstable angina. Coronary angiography revealed subtotal occlusion at the middle portion of the left circumflex coronary artery. BMPP imaging has been evaluated for the first time by clinical guidelines of the Japanese Circulatory Society in 2005. Among many clinical conditions in which BMPP imaging is proposed for diagnostic utility, it is considered particularly suitable for the diagnosis of unstable angina and vasospastic angina. So I will show you some typical cases. This slide shows coronary angiography is an 80-year-old man with unstable angina. Although significant stenosis were found in the three major coronaries, Dr. Nakagawa, a friend of mine, decided to perform PCI to the LAD region based on FFR measurements. On the next day, BMPP SPECT revealed ischemic memory imaging only in the LAD territory, which assured his rightful decision for a therapeutic strategy. This coronary angiography is also of a 50-year-old patient with unstable angina. Among stenotic lesions indicated by arrows, Dr. Nakagawa performed PCI to the LCX region. On the next day, BMPP SPECT showed ischemic memory imaging only in the LCX territory, which again guaranteed his correct judgment for the culprit region in PCI. In this young female patient with suspected vasospastic angina, BMPP imaging showed decreased uptake of BMPP in the inferoseptal and anterior segment in the delayed image. During invasive coronary angiography, a provocation test using intracoronary injection of acetylcholine was performed. At baseline, before the provocation test, the right coronary artery showed no significant stenosis. Total occlusion occurred in the proximal right coronary artery after an intracoronary injection of acetylcholine. After an injection of isosulfide dinitrate, spasm of the right coronary artery was gradually released. For the progress value of BMPP in patients with coronary artery disease, we evaluated 270 patients with a 4-year follow-up period. The analysis showed an event-free survival rate of 92% at 3 years in patients with a BMPP defect score lower than 5, but 80% in those with a defect score of 5 or greater. In the latest Japanese clinical guidelines published in 2018 in Japanese, the clinical application of BMPP imaging is extended. As you can see in these recommendations set by the Japanese Circulation Society, BMPP imaging is suitable not only in unstable angina and vasospastic angina, but also in dialysis patients. This slide of a 75-year-old hemodialysis patient shows triple vessel disease by coronary angiography, as stenosis shown by arrows. Although resting thallium imaging is normal, the BMPP detects abnormal findings in corresponding coronary anatomy. This may be partly explained by repetitive myocardial ischemia, sufficient to cause ischemic memory imaging, which is aggravated by frequent hemodynamic changes during hemodialysis. Japanese multicenter study collected 677 asymptomatic hemodialysis patients and followed them for 3 years. Kaplan-Meier estimates of cardiac-derived death-free survival based on BMPP summed scores are shown in this slide. Event-free rates of cardiac-derived death are aggravated with increasing summed BMPP scores when separated into 3 groups. Thus, BMPP imaging at rest is considered useful not only in detecting coronary artery disease, but also in risk stratification for hemodialysis patients. This interesting elderly case was presented by Professor Matsumoto. His chief complaint was dyspnea on effort, although electrocardiogram of 1 year before showed minor abnormalities. ECG taken at the clinic at that day showed inverted T waves in the precordial and lateral leads, which were compatible with acute coronary syndrome. Because the patient was 90-year-old, Professor Matsumoto decided to perform resting dual spectral imaging with BMPP and technetium tetraphosphine. This spectral imaging demonstrates decreased BMPP uptake in the anterolateral segments. Subsequently, coronary angiography revealed severe stenosis in the LADE proximal to the diagonal branch. Then PCI was successfully performed to this severely stenotic region. We applied this dual isotope imaging with BMPP and technetium sestamib to patients with acute myocardial infarction. These data have been presented at ESC 2018 Congress in Munich. Previous Japanese evidence regarding dual isotope imaging with thallium and BMPP in AMI patients was based on the use of conventional angle camera with high radiation exposure. Matched defect represent a scar or non-viable myocardium, while mismatched defect, usually greater BMPP defect in comparison to lesser thallium defect, implied jeopardized but viable myocardium. Previously, the angle camera cannot distinguish photo peaks of iodine and technetium. However, because of its high sensitivity, CGT SPECT could distinguish photo peaks of technetium sestamib from that of iodine labeled BMPP and could enable to reduce radiation exposure. Therefore, the objectives of this study were to evaluate the diagnostic value of simultaneous dual isotope imaging with technetium sestamib and BMPP in the detection of not only salvaged myocardium, but also severe coronary stenosis in the non-infarcted territory in 44 patients with AMI. The dual isotope imaging protocol is shown in this slide. At first, 370 megabecquerel of technetium sestamib was administered at rest, and 40 minutes later, 111 megabecquerel of BMPP was added. 20 minutes later, the simultaneous dual isotope imaging was commenced. Of note, total radiation exposure with this protocol was 5.1 millisievert. In the result, comparison of defect scores in the infarcted territory between sestamib and BMPP is shown in this table. BMPP defect scores were significantly greater than sestamib defect scores, regardless of the site of myocardial infarction. The diagnostic yield for AMI were 93% by sestamib and 98% by BMPP. We also compared defect scores in the non-infarcted territory between sestamib and BMPP. Again, BMPP defect scores in the individual coronary territory were significantly greater than sestamib defect scores. Now, I would like to focus on the non-infarcted territory. To detect severe coronary stenosis in the 84 non-infarcted areas, respective sensitivity, specificity, and accuracy were 59%, 54%, and 56% with sestamib only, and 84%, 50%, and 63% with BMPP only. However, this diagnostic performance was improved with 72% sensitivity, 87% accurate specificity, and 81% accuracy by applying dual isotope imaging at rest. Representative images in a patient with AMI in inferior posterior wall are shown in this slide. coronary angiography revealed total occlusion of the right coronary artery and associated severe narrowing of the LAD. Much defects were observed in the inferior posterior wall, while mismatched defects were observed in the septal and apical wall. These results indicate ischemic memory in the remote LAD territory. Therefore, we concluded that the simultaneous SESAMIBI and BMPP dual isotope imaging at rest with low radiation exposure may be feasible not only for the evaluation of infarcted myocardium, but also for identification of severe residual stenosis in the non-infarcted territory in patients with AMI without the need for the stress during the early phase. In this lecture, I have talked about the development of an ultra-fast CGT gamma camera system with adequate acquisition protocol in our institution. Then I have shown hybrid imaging with CGT SPECT and CT coronary angiography. In the last section, I discussed the feasibility of dual isotope imaging using iodine, BMIPP, and technetium radiotracers. In conclusion, ladies and gentlemen, our approach using CGT gamma camera system with hybrid imaging and dual isotope offers us a bright new horizon for myocardial imaging in the near future. Thank you for your attention.